Hey Rebels, decided to do our educational video from a little change of scenery outside today. I'm sitting at the picnic table where in the past we've taken our lunches out here or done team meetings, but I have a special message for you today, and it is surrounding how insurance works for your healthcare and for paying for your chiropractic. Quite a bit of research has gone into this. I want to make sure that this is communicated clearly. So I want to open up with this question, which is also the subject of this video. And the question is, do you believe that insurance should pay for 100% of your chiropractic care? And the question is not a political one. I'm not trying to ask, do you believe that our government should provide universal health care, or do you think that the government should provide this sort of thing? The question I'm asking is, with our current system of insurance, do you believe that as it is designed, your insurance should pay for all of your chiropractic care? Because the reason that I'm asking this is I believe that a lot of people think that this is true, when in fact it's just not. And it's not the fault of the provider, it's not the fault of the chiropractor, or this holds true actually across professions, but I want to share some differences that chiropractic has, mainly because chiropractic is utilized not just for emergencies, but it's also used for regular maintenance and prevention. And that's where it gets a little bit tricky when it comes to utilizing your insurance. And so without further ado, I wanted to draw a quick comparison to, say for instance, car insurance. Do you believe that car insurance should pay for your oil changes or for your belt rotations or tire rotations, things like that? The answer, of course, is no, as much as we might like it to. Those things are regular maintenance, and we realize that if we do those regularly when we're supposed to, the life of our car is going to be extended, the quality of life of our car is going to be improved. And it would make a lot of sense for insurance companies, honestly, to pay for those things, because if they did pay for those things, they would probably not have to pay for a lot of other things that happen due to wear and tear causing accidents and things like that. However, that's not the world that we live in. So car insurance is meant for emergencies or accidents, not for regular maintenance. Think about disability insurance. I carry disability insurance just in case something happens to me. But what if something happens to me like the flu bug? If I'm just not feeling well that day, does my disability insurance pay me for that particular day where I wasn't able to go into work? No, because it wasn't a life-altering, emergent kind of scenario. And so you get the point that insurance, and all insurances, like home insurance, home insurance doesn't pay for you to replace the light bulbs or replace the furnace, all those kinds of things. Home insurance, car insurance in general is designed for emergent or like active problems, whereas as far as maintenance, it's not designed for that at all. So I think we can all agree that there is this threshold that separates and defines something that is severe enough or emergent enough to be an insurance issue versus regular maintenance. Now, as far as what is considered regular maintenance, that's actually defined by the Centers for Medicaid and Medicare Services. You can find these on cms.gov. So this is the law of the land. This is what is defined under their terms. So if you've been to our office, you should know what a subluxation is. That's what the chiropractor is utilizing adjustments in order to reduce or remove in order to increase the quality of life of that person. And so the Centers for Medicare and Medicaid Services, run by the Department of Health and Human Services, subcategorizes subluxation into two categories, into an acute subluxation and into a chronic subluxation. So the acute subluxation, they define that as meaning a new injury. So in other words, this adjustment delivered by a chiropractor must be for the improvement in or an arrest of the progression of that person's condition that they are diagnosed with. So I'll say it one more time. It's for the improvement in or arrest the progression of a patient's chronic condition. And so what this means is that it has to be something new, and in order to define it, there are 4 things that need to be present. And an easy way to remember this is to break it down into 4 letters, P-A-R-T. We call it PART. And so it has to have pain, It has to have a decrease in range of motion. It has to show an asymmetry, typically of the musculoskeletal system, and it has to show tissue changes, PART. And for us to qualify that as a new injury or as an acute subluxation, they have to have 2 of those 4 components. And if you only have 2 of those components, one of them cannot be pain. And I think this is primarily due to the fact that pain is so subjective. And if people really wanted to work the system, and trust me, people try to work the system all the time, they say, oh doc, yeah, it really hurts right here. Do you think you could bill this as a new injury? No, man, it's not all about the pain. It has to show those other things as well, that asymmetry, the decrease in range of motion, and the tissue changes. And if you only have the pain, or if you only have the pain in one other thing, then you still have to have another qualifier in order to be a service that is considered an acute subluxation that is billable to insurance. Now, the opposite of an acute subluxation is a chronic subluxation. And a chronic subluxation is a subluxation that is, it's a condition that is not expected to improve, however, or even if, the result is a continued functional improvement. This continued functional improvement will allow us to be able to utilize it for a while. However, it eventually runs out, and that maintenance therapy is what they eventually call it. And maintenance therapy, by definition, by their own terms, by the law of the land, is not covered. So that is the difference between acute and chronic subluxation. And so I don't know how many of you go to the chiropractor for these reasons, but how many of you go, by a show of hands, go to the chiropractor to prevent disease, to promote your health, to prolong or enhance your quality of life, to maintain or prevent the deterioration of a chronic condition that you had? Maybe it's an injury that you had when you were growing up or something like that. How many of you go to the chiropractor for those things? Probably a lot of us. Those reasons for seeing a chiropractor are all considered maintenance care, or we call it wellness care. It's the same thing. And I was reading, as you could see, from, and I took it verbatim from CMS.gov, the Centers for Medicare and Medicaid Services. And they say there, and I quote, "Services that seek to prevent disease, promote health, and prolong and enhance quality of life, or maintain or prevent deterioration of a chronic condition, whether further improvement cannot be reasonably expected from continuous ongoing care, the chiropractic treatment becomes supportive rather than corrective in nature, and the treatment is considered maintenance therapy and is no longer a covered service." So basically they're saying that if you got something wrong with you, that they will help you with your care. But if there's nothing wrong with you and all you want to do is stay that way and you still want to see your chiropractor so that you can maintain your health, they're saying that, sorry, that's on you. We're not going to be paying for that. That's just the way of the world. And so translation, what does this mean for you? Why am I even doing this video? So we live in a world where our healthcare system is actually financially, if you think about it, financially incentivized to either not get people well or pretend that they aren't well so that they can continue to bill insurance for active care that just isn't true. There's some truth to that, right? If I have people coming into me saying, man, I wish I had something wrong, then I could bill this to insurance. It'd be a heck of a lot cheaper. There's something wrong with that when people are actually wishing that there was something wrong when we've gotten them well. It's nonsensical. And so the hard truth is that at the end of the day, 100% of anyone's chiropractic care is never, ever, ever covered by insurance, nor do I honestly think that it should be. Do I think that insurance, the purpose of insurance is to cover maintenance care? No, I don't. I don't think it's the purpose of insurance to cover maintenance on my car or on my house. And I think that that same principle holds true for our health. So once you move into supportive care, your cost per visit without insurance may go up. However, the flip side of that, at least in our office, is that when someone's under maintenance care, their frequency of visits is so low that although the cost of their per visit goes up slightly, their frequency is so low that their total cost is still extremely affordable, even if no insurance is participating whatsoever. So that's how we've designed our office, and so that people, if they prioritize their health, they can find a way in order to be able to afford it. So the problem that I've been experiencing is that I've had people come in and say, hey, we really like it here, Dr. Tyler. However, since you won't bill for my maintenance care, there's a chiropractor down the street that will. I have a problem with that because That is simply not the way it's meant to be. And I can only think of two scenarios that would make this possible. Either they are finding a new injury, finding a new subluxation, based on those four things, or they're making it up. And I'm not saying one or the other is true. All I'm saying is that with the level of technology that we utilize and assessing people on every single visit with our instrumentation and with our motion and static palpation and taking a good history on their first visits and having scheduled assessments and reassessments, I'd be pretty surprised if there was something that was found that we did not find in this kind of scenario. So that's the hard truth. So if somebody comes in and says, I'm going to go somewhere else because you're not going to bill it the way that I think it should be billed, in my opinion, that's a ticking time bomb. And Rebel is not willing to risk our reputation, risk even getting close to going against what the law of the land would say. I ask you this question: Do people speed? Do you break the speed limit? Probably all the time, right? Is breaking the speed limit breaking the law? Of course it is. However, most people only do it because most of the time they get away with it. Does that make it right? Does that mean that they're not breaking the law? No, of course not. So when you're breaking the speed limit, you're breaking the law, and we shouldn't do it to begin with. Just because somebody doesn't get caught for billing inappropriately doesn't mean it's not right. And so what you will not see from Rebel is exactly that. What you will see from Rebel is this. You will see a solid active care period in order to reduce vertebral subluxation and improve functional measures. We will measure those improvements over time, and we start that from day one, and we do assessments over time. We will measure that improvement at these designated reassessment appointments. We will responsibly end active care and transition our patients into supportive care and bill appropriately, legally, and affordably. We will follow Medicare and Medicaid federal guidelines to the T. We will never risk the compliance of our practice for a few people who may refuse to agree with our stances. We will continue to promote health and wellness and maintenance care as an asset that can be grown if it's invested in, and how much affordable it really can be, and how much it pays to stay well rather than to try and get well from episode to episode to episode. Until you've lost the level of your health. That's what you're going to see from Rebel. And so if you've never heard any of this before, if you've been to chiropractors and it's always been covered and they always just keep on billing, there's a study done in 2014 that said that and this was done by Medicare and Medicaid, all chiropractic services billed reported a 54% error rate. So out of all the services billed, there was a 1 in 2 chance that one of them was billed inappropriately. And this was done in 2014. So if they're not doing it exactly the way that I described right there, it's not right. And this is not just Medicare and Medicaid. They set the law or the precedent for all commercial insurances. So if we're talking about all, essentially all the insurances that you would have through your employers. They're run the same exact way under the same laws, same requirements, same guidelines. So I hope this video was helpful. I hope it's helpful to you and makes some sense out of it. It's kind of a nonsensical system that we work within. Basically, if you're in pain, if you have asymmetry, if you have dysfunction, if you have decreased range of motion, if you have tissue changes, then that's a billable insurance case. If you come in and even if you have pain, even if you feel like it's increasing the quality of your life, even if you utilize chiropractic care to get you out of a hole and now you're in a really good spot and now you just want to maintain that level of care and you know that if you get adjusted regularly, you can stay out of that hole, those aren't billable services. That's maintenance care, and that's just the way it is. So hopefully you receive this in love and understand this is exactly why we're doing what we're doing. And hopefully you seek out a chiropractor because of the service that they provide, not the way that they bill insurance and seems like it cuts you a deal compared to maybe, a Rebel, an office like Rebel, which doesn't compromise on that. So thanks, and you guys can have a great day.